Hello, and welcome to From the EBPL Archives, Encore presentations from the East Brunswick Public Library. I am your host, Melissa Hosick. This event was presented as part of our Just for the Health of It initiative. Just for the Health of It is a proprietary health literacy program developed by the East Brunswick Public Library to promote health literacy in Middlesex County. To learn more, visit justforthehealthofit.org. Now, enjoy the program.
Welcome and thank you for joining us this afternoon for today's Lunch and Learn with the Doctor on arthritis. My name is Kathy Chern and I'm a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by St. Peter's University Hospital and the library's Just for the Health of It initiative to promote community health and wellness. Our speaker today is Dr. Sangeetha Pabolu, rheumatology specialist and chief of the Division of Rheumatology at St. Peter's University Hospital. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. The recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. Our speaker will answer questions at the end of the talk. Our speaker will not be able to offer medical advice to attendees during this program. And without further ado, I'll turn things over to Dr. Pabolu.
Hello, everyone. Thank you for coming in here today for this discussion on arthritis. And thank you, Catherine and the East Brunswick Public Library for inviting me for this discussion. As she has informed you earlier, I will show a few slides and talk about arthritis in general, and then we can discuss more questions at the end. So the first thing that comes to mind is, what is arthritis, right? Most of you probably already know that it's the problem with the joints, and it can be any joint in the body. I have just put a picture of knee arthritis here. So any condition that affects joints, causing pain, swelling, redness, stiffness, or limitation, any of those symptoms in the joints can be from arthritis. So how common is it? So if you look at the statistics, 1 in every 4 people have some form of arthritis. And if you actually look at these numbers, 54 million Americans are suffering with arthritis at this time. So it's almost a big chunk of population, 25% of the people. And it's a common cause of disability in this country. So is arthritis just a problem of joints, or is it a problem of the whole body? So many types of arthritis can be just limited to the joints. However, some of them, when they are severe, they can affect other parts of the body as well. So I have listed a few parts of the body here that arthritis can affect. It can cause problems in the heart, can go in the eyes, lungs, kidneys, and even skin. So what are the common risk factors for arthritis? It's been shown that smoking can cause certain kinds of arthritis. Alcohol has a role. Obesity and overweight can contribute to it. But a big percentage of arthritis can be just genetic. So if someone in your family has arthritis, then you may be at risk for it and needs to be checked out. It is common more in women than men. Certain types are common in men as well. And the usual arthritis called osteoarthritis gets more frequent with age as well. So, however, it can happen at any age and it can happen in both genders. What are some of the common types of arthritis? You may have heard these names. Osteoarthritis is the most common one. 3 million Americans per year are diagnosed with osteoarthritis. That's a big number of people. And next comes gout. Gout can cause a type of arthritis. That's the second common. And there is rheumatoid arthritis, psoriatic arthritis, lupus, and there is many more. There is almost close to 100 kinds of arthritis. So this is a picture showing what happens inside the joint when someone has arthritis. This is a normal knee joint. There is a bone from the top, bone from the bottom, and then there are structures in between them. So there is some liquid or fluid here, which keeps the shock absorbing and keeps the joint fluid for smooth function. Just like imagine if you have a car or any machine, between any two structures that are constantly moving, you need the lubricant or the lube. So that's what the usual joints have. But with age and activities and sometimes with inflammation, that gets damaged. So as you can see here, there is no more fluid or lube between the bones. So it's bone on bone, and that happens in osteoarthritis. But what happens in rheumatoid and many other types of arthritis with inflammation is that there is inflammation around the joint. This red is indicating inflammation, so that can cause a lot of problems. Here's a picture of osteoarthritis. As you can see, this person has changes in their joints. It's pretty obvious that there is bigger fingers or knuckles than usual, and this can happen over years. It's not something that's very instant and happens overnight. I've put a picture of gout here. It's more common in feet than other joints, but it can happen in any joints. As you can see, there is some redness near the ankle and the big toe. So that's an indication of inflammation. So this causes severe pain. In fact, they call it worst pain in a person's life in men, and they compare it with labor pain in women. It's very severe. Here's a picture of rheumatoid arthritis. So it looks more crippling and severe than osteoarthritis. So there can be lumps and bumps. Fingers can turn and look like cripple, and people have trouble using their hands. They have trouble holding things. They lose strength. They hurt. This is a very late stage of rheumatoid arthritis, but this can be prevented if it's identified and treated with appropriate medications right from the beginning. All of this can be prevented. Here's a picture of psoriatic arthritis. If you can see, there is some damage to the skin and nails in addition to the joints. So that's a feature of psoriatic arthritis. So this happens in people who have psoriasis, which is a skin condition. So in general, what can you do to prevent arthritis? So there are some lifestyle changes that you can make. Number one is diet. So the foods that you put into your body have an effect on how your joints feel and how much you can handle the pain. So as you can see in this picture, it's in general any healthy diet. So we're looking at fruits, vegetables, lean meat like fish or chicken more than red meat or others. Nuts are good for you. Beans are good. Olive oil has been shown to be better than other oils. Some people describe this more like a Mediterranean diet because that includes fish, olive oil. And lately, we are seeing some studies looking at the health benefits of turmeric, especially the joints. And so that has been included in this list as well. So next good thing that you can do to prevent arthritis and joint muscle pain is regular exercise. So I recommend all of you spend at least 30 minutes every day in doing some sort of exercise, whatever works for you, whatever you like, whatever your body permits. Any movement is better than no movement. So move more, eat healthy foods, and keep your joints moving. So the next good thing you can do to yourself is getting enough sleep. So sleep has been shown to affect how the body feels. It's very clear that when somebody doesn't sleep well, they don't feel rested in the morning and they hurt more. And over long term, over years, they develop what you call chronic pain. It can be in the muscles or joints, and those people tend to hurt more who are not getting enough good quality sleep. So anything you can do to get good amount and good quality sleep will make you feel better when it comes to joints, muscles, and pain. Next thing is stress. So we all agree that stress has become part of life for everyone. There is no age limit, there is no gender or profession where there is no stress. So it's everywhere and it's everyone's life. But there are ways how to recognize and handle stress. So here's a picture showing that exercise helps in stress control, playing, whether it's kids or pets or people. Meditation helps, yoga helps, stretching helps, music is good, nap or getting good quality of sleep. All of those help to manage stress. So try to identify what is making you worried and try to act on that. And if you need help, take a professional help to manage your stress, because more stress causes more pain. So let's say you've done all the measures that you can do to prevent arthritis, but still some people develop it because, like I said, there is genetic risk, there is familial risk. So some of the genes that you're carrying can put you at risk for it, which you cannot change by changing your lifestyle. So when that happens, you really need help. And how do you approach it? So the first thing to do is to discuss with your primary care physician. So some of the joint muscle problems and arthritis can be handled by primary care physicians. So they look at the things that's causing pain and symptoms of arthritis, and they may treat you accordingly. But if they feel like you need to see a specialist, then they may refer to a rheumatologist if that is appropriate. So who's a rheumatologist? So rheumatologists are the doctors who complete 3 years of initial general medicine training, and then they do 2 to 3 years of special training, especially in arthritis and joint and muscle problems. Like I mentioned earlier, there are more than 100 types of arthritis. So when you say arthritis, it's not one thing. There is many types of arthritis, which is what the rheumatologists get trained in. So they can identify and explain you what type you have and help you with the treatments. So what are some of the treatments for arthritis in general? So there is several forms of medication. The usual and first line treatments after somebody fails lifestyle measures is prescription tablets or capsules, oral medications. And there are several of them. We won't go into the details. So it depends on what type of arthritis we are talking about and trying to treat. However, there is also other forms of treatment. When somebody fails these, there are stronger medications such as injections, infusions. Some of you may have heard commercials about these. I just put in some names, but we have no connection with any of that particular company. So there is several options for this. And in the last 20 years, there is many more newer medications that have become available. So now we have a lot of options of treating arthritis, especially if we catch it early and treat it appropriately. Some of the other methods of treatments doctors might recommend is injections into the joints. This is a common procedure done in the clinic without any previous preparation. And if based on the patient's type of arthritis, the rheumatologist or your doctor might recommend going through an injection into the joint. It is not a surgery or a high-risk procedure. But if all of those fail, then in some types of arthritis, people may need surgery or joint replacement. So I put this picture to show you that this gentleman was first started having symptoms in his joints, especially in his back, in 1947. But over the years, he was followed upon. And as you can see, in 10 years, he developed some problems with the neck and spine, and now his posture has changed. And that continued to progress over the years. He ended up with a cane and unable to stand straight. But this was before we had a lot of injection and newer medications. But now this arthritis, especially this person had what we call spondyloarthritis, where there is inflammation in the neck and spine. This is completely preventable. Let's say if the person comes in this stage, and if we diagnose early enough and treat appropriately, all of this can be prevented. So I've used resources from Arthritis Foundation and American College of Rheumatology. So with this, we're done with the slides. Now we can open up for questions and more discussion.
Okay, great. Thank you, Dr. Pabolu. So if you have any questions, please type them into the chat box. And as a reminder, the doctor is unable to offer medical advice to attendees during this program. And we also have some questions that were previously emailed in. One of them is the use of glucosamine and chondroitin helpful for patients with osteoarthritis?
Great question, and a common question that I come across because these supplements are available over the counter, and many people have started using them and ask about this question. So as of now, the scientists are not entirely sure if this substance is useful. So, but also they haven't found any harm from it. So because of those reasons, the experts say that it is something you can try, and if it helps you with your symptoms, it is okay to continue. But as physicians or scientists, they're not recommending to take this for everyone, but it's just an option that can be tried.
And then is there a relationship or connection between Crohn's disease and joint inflammation?
Another great question. Yes, there is a connection. So people who develop Crohn's disease can develop a kind of arthritis, which I was earlier saying called spondyloarthritis, or in more specific, it is called enteropathic arthritis, because these people not only develop inflammation in the bowels, which is the Crohn's disease, they can have the same inflammation going on in their joints and develop arthritis. But the good thing is the medications that are available these days, some of them work for both problems. So it's just that the doctor has to choose the right medicine to control the inflammation, both in their gut or the bowels and the joints. So yes, Crohn's disease can have arthritis along with it.
Is there any danger in getting numerous injections over a period of time for arthritis of the knee?
Right. So there is remote risk of repeat injections. So every time we inject a medicine into a joint, usually the knees, first of all, there is a risk of damage because of the needle entry, as you are putting a needle from outside the body to inside. And also the medicine that we are injecting can also have some side effects in the joint. However, the doctor will explain and discuss with you and suggest an injection only when they think the benefit is more than the harm. So that's a personal discussion you would make with your doctor to see if you would benefit from an injection. But overall, the recommendations are that we don't do frequent injections. That's why you probably have seen none of your doctors injecting you more often than once in every 3 months, because too often injection can make your harm more than your benefit. So it just has to be spaced out, but when it is appropriate, it can be repeated every 3 months if that person is benefiting from the injections.
And another question that someone submitted, I sometimes get buckling pain in the back of my left knee. Is this related to my arthritis or is something else going on? And if something else, what are the possibilities?
Right. So it's a bit limited answer, just answering it based on what you're telling me, because any evaluation is incomplete without looking and feeling the joint by the doctor. But in general, buckling can be a problem of structures in the knee, what they call menisci and ligaments. So when there are problems with meniscus is like a little C-shaped thin structure in the knee that helps with the movements. So when there is a break in that, it can cause buckling, and sometimes it can cause a fall because the person loses balance with the knee buckling. So it would need some physical exam by the doctor, and it may need some investigation like an X-ray or an MRI to confirm it, and then it needs to be treated appropriately.
And now we have some questions in the chat. Typically, what is the success rate of injections? How long can it last to relieve knee pain?
Right. So when we talk about injections, there are several types. But the common one that they use for knee osteoarthritis is called cortisone or steroid of some form, which controls the inflammation and also helps with the pain. So if we are talking about those, then some people respond and see the benefit for several weeks to months. But again, it's not 100% guaranteed. Some people do not respond to them at all, but it is an individual option based on what type of arthritis you have, and it would be a discussion with your doctor, given your other medical problems, if it is advisable for you or not.
And then can weather affect arthritis?
Yes. So several types of arthritis can be affected by weather, especially cold weather, damp weather, or anytime there is a sudden change in the atmospheric pressure. Like, let's say, one day it was cold, the next day it was hot, or any change in that weather can bother the joints. And scientifically, they have seen that that's because of the change in the pressure in the atmosphere, but it's a very common symptom people experience, and many of the arthritis patients describe that. So at times, it looks like the arthritis people are better predictors of weather than the weatherman.
And can you repeat what is the first approach? Talk to your primary doctor or to a rheumatologist?
Yeah, I would recommend always to start with your primary care doctor so that they will be able to figure out if rheumatologist is the right doctor to see or another specialist, because symptoms in the muscles and joints can be from many health conditions. Sometimes it may be an orthopedics doctor that you need to see first, or it may be a pain doctor. So it depends on what exactly you're going through. So it is always best to discuss with your primary care doctor, who can guide and recommend you to see the appropriate specialist.
What about taking turmeric? And is it recommended to be taken with black pepper or better to purchase a preparation of turmeric?
Right. Um, Great question, and a common question. So regarding turmeric, what they've done is they've done a study looking at people taking turmeric. Um, a group of people with arthritis, they gave turmeric, and the other group, they gave naproxen, which is a medicine called naproxen, which is either over the counter or even prescribed by doctors. So they found that turmeric was good enough, like naproxen, and relieved the pain in the joints. So that's how the recommendation of turmeric comes into practice. So it can be taken in many different forms. I feel, I mean, by science, we don't know exactly yet what is the best way to consume it, but it's just my opinion that it should be consumed in its natural way. So ancient Indian cuisine, and I think many other cuisines may also use turmeric in food preparation. So it is used in the recipes that we make. But I mean, I know that not all of you will cook Indian, so I would suggest that you could consume it in other forms. Now they are available as capsules over the counter, and the dosing is written on the bottle. So you could consume that way. I have seen some of my arthritis patients consuming turmeric capsules and has found benefit. So it looks like it could be taken in any form that is available. Regarding pepper, I do not know or have seen anything connected with that. So it's not necessarily needed to be taken with pepper.
I have psoriasis and don't know if my arthritis is a result of that. I am wary of the side effects of the prescriptions for psoriatic arthritis and have not followed up with the doctor. What medicine has the fewest side effects for psoriatic arthritis?
Mhm. So yes, just like we talked about Crohn's disease having a connection with arthritis, psoriasis has a connection with arthritis, a very similar one to the one that people with Crohn's disease get. And it's a real type of arthritis. It can cause inflammation in your joints, which can cause pain, swelling, and stiffness, and limited range of motion. So it's really important that you talk to your doctor and get this evaluated. There are several treatments for psoriatic arthritis. There are pills, there are injections, there are infusions. Every medicine comes with its risk and benefit package. So it's ideally best to discuss with your doctor. And in general, physicians are advised to recommend the medications only if the benefit is more than the risk. So when it is needed, it is needed. And if it comes with a risk, it will be monitored by the doctor. But it's a personal discussion you'll have to make with your doctor to see what is the best treatment for you.
Can exercise such as running be not advisable for someone with osteoporosis?
If it's osteoporosis, running is good because any weight bearing exercise like walking, running is good for osteoporosis. But if you're talking about osteoarthritis, especially in the knees, even then running is fine. For some people, the knee pain will go away once they start running. However, if running is making your pain worse, then you may have to modify your exercise, which means you have to try to go to a different form of exercise which doesn't bother the knees, like which doesn't put pressure on the knees. So rowing is an option. Now all the gyms have rowers. Swimming is good because you're doing a workout of all the muscles and joints, but it's not necessarily putting pressure on the knees. And any other forms of exercise that doesn't put pressure on the knees can be an option for you.
Is rheumatoids connected to arthritis?
Good. So for those of you who don't know what Raynaud's is, I'll give you a little bit idea about it. So some people, especially in the cold weather or when they're going through a stressful situation, they see that their fingertips or toes turn colors and can hurt. Sometimes they can turn white. Sometimes it can be blue or red color of your fingertips, and they hurt in the cold weather. So that's called Raynaud's. So there are two types of Raynaud's. One of it has connection with some types of arthritis, but the other type do not have any connection. So that is where your doctor's advice is needed to figure out if that is a primary Raynaud's where it has no connection with arthritis, which is treated differently from the other type, which can be associated with arthritis. So the rheumatologist is a good doctor to see Raynaud's so that they can check you as a whole person and figure out if it has any connection.
At what point do you know that knee replacement surgery is your best option?
Right. So in general, knee replacement is advised when somebody has pain all the time in their knees, even while they're resting, like even when they're just sitting and watching TV, they're not walking or putting weight on their knees, or if they're hurting at night, like when they're laying down, sleeping or taking rest, but they're having pain, then that's almost an indication to get a knee replacement. But if you are dealing with a different type of knee arthritis, let's say like rheumatoid arthritis or psoriatic arthritis, where there is knee pain and inflammation, then you may not need a knee replacement. What you need is some medications to treat that inflammation. And when we control that inflammation, that knee pain may disappear. So then you may not need a replacement. So it's something you should really discuss with your doctor to figure out what exactly is going on in your knee and see if replacement is the right choice for you.
Okay. How can you diagnose a early stage of osteoarthritis?
Mhm. So it's a combination of things. So it's not like a one step test where you can say yes or no. So it depends on what kind of symptoms you have, what the doctor sees on your physical exam. Sometimes they may require x-rays, but other times they may not. So it's a combination of things. So it cannot be answered by just one question.
And can anything be done to discontinue joint damage in the hands from osteoarthritis?
Right. So regarding osteoarthritis of hands, unfortunately, there is not any medications which can slow down the process or stop the process. There is still a lot of research going on, but as of now, the treatment includes more of relieving the pain, swelling, or stiffness, or whatever symptoms person has. So medications help that way. But in general, when you stick with the healthy diet, exercise, and other lifestyle measures we talked about, it may not stop the process, but people feel less pain. So that's the advantage of doing your lifestyle changes when you have osteoarthritis.
And what treatment is given for osteoarthritis of the hands and or fingers?
Mhm. Again, there are several options, and it depends on the person's age, what other health problems they have, what medications they are taking to make sure that medication is safe for you. But in general, it is treated with pain relievers like Tylenol, ibuprofen, Advil, Aleve kind of medications that we find in the pharmacies. But then again, each and every medication has to be checked by the doctor to make sure that it's safe for you. And then if somebody fails those, then there are some prescription medicines which can be prescribed at that point. So it's always best to discuss with your primary doctor.
And can radiation for cancer enhance the negative signs of psoriatic arthritis?
So radiation treatment has some effects on how people feel with their skin, joints, and muscles. It's a much more complex phenomenon than we think. So it depends on, first of all, it may depend on the type of the cancer as well, and then it depends on the cancer treatments as well. So we won't be able to tell a generic um, advice for that. It has to be evaluated individually. But yes, there are effects of radiation on joints and muscles and skin.
Okay, so I don't see any more questions in the chat, so I'll just do one last call for questions
Okay.
and just wait 1 or 2 minutes if there aren't any more questions and we'll conclude. Oh, another question just popped in. So
Okay.
is there any relationship of spinal stenosis to arthritis?
Yeah. So spinal stenosis can be a consequence of arthritis. So what can happen is when people have arthritis in their back and develop bone spurs. Bone spurs are extra growths of the bones and the joints in the back. then they take away the space that's available for the normal structures. So we all have nerves going down the spine in our back that supplies legs, arms, and waist and rest of the body. So when the bone spurs or the arthritis changes take away the space that's available in there, then it can cause narrowing and congestion in that area that can put pressure on the nerves and cause pain. So arthritis can lead to those symptoms and so can lead to stenosis. Yes.
Okay. And then another question about if you could please repeat about the dosage for turmeric if you're taking it as pills.
Yeah. So there is no one recommended dose yet based on the studies. So I believe the over-the-counter is something like 200 milligrams or so. Usually, depending on what kind of formulation they are selling, the bottle itself will say how many you should take in a day. Because there are different kinds of formulations now in the market and different companies are making it, they will advise you what is the safe dose. So you should just go by what kind of bottle you have.
And then have you ever heard of cysts in the fingers related to arthritis?
Yes. So people with rheumatoid arthritis can develop cysts in their joints. These are called synovial cysts. If you remember the picture I've showed you earlier, where there is inflammation in the joint, there will be more fluid and more cells in the joint. So that makes the joint pop out as a cyst. And that can be called a synovial cyst or cyst in the joint. Yes.
Okay. And does taking the steps to the second floor usually cause more damage in osteoarthritis cases?
Yeah. So this is a controversial topic because some scientists say that the usual exercise that you do or the normal activity for somebody on a daily basis is good for the knee joints, but then there is other group of scientists saying that oh no, that's actually as a risk factor for knee arthritis. So I guess it's more about listening to your body at this point. If taking the stairs is hurting more, then it's better to avoid. But if you take stairs and then you feel better with that form of exercise, then you can continue to do that.
Then can you take NSAIDs for a long period of time?
So it is not advisable to take NSAIDs for long-term purposes because they have side effects. Especially one big thing is that they can cause slow damage to the kidneys when they're used over the months or years. Now they are also seeing that they can cause problems with the heart and cardiovascular system, and they can cause many other side effects as well. So in general, they are not advisable to be taken for long-term purposes.
Okay. And back to turmeric again. Does
Mhm.
turmeric interact with other medicines?
We do not know of any interactions of turmeric with medications because turmeric is a food substance. And as we see that it can be consumed as a food, just like you can imagine any spices that you're using, like cinnamon or whatever food substances you use, they don't interact with medication. So we don't know of any interactions. So it should be okay.
So that's it for the questions. So I want to say thank you, Dr. Pabolu, for taking the time to present on this topic and to answer all our questions, or many questions.
Sure.
And next month, we'll have a lunch and learn with the doctor about choosing a successful exercise routine. And it'll take place on Friday, March 5th at 12 p.m. So you can register for this program at ebpl.org/calendar. And for everyone who joined us today, thank you for joining us and take care and stay safe. Okay, thank you.
Thank you, everyone. Bye-bye.
Thank you for joining us for this week's Encore presentation. To join us for live programs or to learn more about the East Brunswick Public Library, visit our website at ebpl.org.